primary healthcare level?
Okay, so yeah, one of the factors that are strongly associated with braxism or grinding of the teeth is psychological stress, or we usually just refer to them as psychological factors, so mainly emotional stress. So stress increases muscle tension. So if you want me to go a bit into the details of how it happens, maybe just a little bit, is that stress or distress, which is the negative response to stress, activates the hypothalamic pituitary axis. So now as a result, there will be an increase in corticosterone levels and release of adrenalines. So due to all these things, the tension in the muscle is increased. So now that results in grinding or clenching of the teeth. So it can happen at night, which is called a sleep braxism, or during the day, mainly clenching and bracing of the mouth, which is awake braxism. So stress doesn't only do that. We also know that stress, due to that, what I just explained, is that it can decrease the amount of saliva in your mouth. So it decreases salivary flow. So all this now can result in ulcers and cavities even in general. Yeah, so that's what stress does. So mainly, it's responsible or strongly associated with braxism. So grinding of the teeth doesn't only happen in adults; it also happens in children, even younger infants, and all that. So this can the long-term consequences of tooth wear can result in delayed eruption. So teeth might not come out at the right time because of the grinding, especially when it happens in children. Yes, and this also now affects the growth of the jaw. That's for children. Yeah, so with teens and adults now kind of falling into the same category, braxism will of course have excessive tooth wear. So now this excessive tooth wear will be associated with hypersensitivity, which even decreases the person to chew and all that. Other than that, now we know we are clenching, and so our muscles are overactive. So usually what happens is we have a joint here which is called the temporomandibular joint, the TMJ. So that means you can also develop TMJ problems or TMD, temporomandibular disorders, because now you are overusing your joint even unnecessarily while you are sleeping, while you are not chewing anything. Yes. So that can result in TMD. And then another thing that can happen is now hypertrophy. So your muscles becomes bigger. So hypertrophy of the masseter muscles and the temporalis muscles. And another thing that is frequently confused with many other things is chronic facial headaches. Yeah. So you are clenching, you are grinding during the night. Sometimes you can have unexplained headaches. Yes. So grinding can be a contributing factor. Yeah. Patients can be educated, just like we are doing now, or the general public can be educated on the link between stress and braxism. So, because it starts with awareness, like we say, braxism, about one fourth of the population is having braxism or suffers from braxism, but they are not aware. So the first thing is awareness of the link. And then the second thing is now oral examinations can be performed so that we detect braxism early. So, and then other things that can be done is now to prevent braxism is stress management techniques, or can be taught to the general public. And again, screening of stress and anxiety in the general population, that will definitely prevent braxism or grinding of the teeth. So there is no permanent treatment or elimination of braxism, as per to say. So what we can do at home, or what is cheaper, of course, is now stress management principles that can be incorporated. Or what we can do now to reduce the damage from braxism is we can use warm compressions on the face, on the muscles of mastication, the chewing muscles, or the muscles that hold the jaw. So, and then we can be massaging them with simple ointments like methyl salicylate ointments. This help. So that massage, it relieves that tension and reduces the level of braxism that the patient is going to experience.